Many questions arise when we face the need to enter an operating room. How long will it last? How will the surgery result? What will be the sequels? What if something goes wrong? But we never ask ourselves, what am I going to feel during surgery? This is because we assume that the anesthesia they give us will make us remain asleep, unconscious, and of course, painless. It would be a horror to wake up while the doctors are still maneuvering with our internal organs, and that our paralyzed body do not allow us to let the doctors know that we are conscious of the environment and of the pain. Although this seems to be incredible, this is the case for many people who have resistance to anesthesia, which stops them from going to a stage of unconsciousness, or they will simply wake up before the expected time. This condition is called anesthesia awareness and is more common than we would think. It is estimated that this condition occurs to 1 or 2 out of 1,000 patients. There are testimonies of people who have gone through this agony, and in many cases, it leaves severe, lifelong emotional scars triggered by such an experience. It is therefore necessary to take therapy to reduce the symptoms of a possible post-traumatic stress disorder. According to surveys, people who presented anesthesia awareness during surgery could perceive sounds, fear, impotence, sensitivity to the details of the operation, paralysis, and pain. Studies have shown that the recording and analysis of electrical signals with strategies such as EEG can determine the patient's degree of consciousness. For example, researchers have conducted studies in which latency in the brain response to auditory stimuli is detected. In this study, it was determined that it is possible to predict the depth of general anesthesia. The use of systems that exist in the market, such as the Acticamp from Brain Product, with the appropriate algorithms could reduce the incidence of conscious anesthesia during operations. So someday, this condition will not exist anymore.